Hello and welcome again to Womb of Wisdom. My name is Kwesida Costa Vroom. It's a pleasure having us in your space. We encourage you to subscribe, comment, share, like, and let's get the conversation going. Just in case you would like to connect with us, you can call or text 347-658-7385, 347-658-7385, or send us email to kwesivroom@gmail.com, KWESIVROOM, and we'll be very happy to interact with you. You can also let us see your comment and what you think about the program. If you have submissions, we'll be very happy to consider them and get the program going. Today's topic is handling children dealing with trauma. We have done the first part. It was a short one, and we're coming your way with a much detailed information. Dealing with children who have experienced trauma can be very challenging and delicate task. Here are some tips on how to handle children dealing with trauma. Create safe environment. Children who have experienced trauma need to feel safe and secure. Create an environment that is predictable, consistent, and safe. Be reassuring, patient, and calm. Listen to them carefully and validate their feelings. 2. Provide comfort and support. Offer comfort and support to the child. Encourage them to talk about their feelings and provide a safe space for them to express themselves. Reassure them that they are not alone and that you are there for them. 3. Be patient. Trauma can impact a child's behavior, emotions, and development. Be patient with them as they may have difficulty expressing themselves or may exhibit challenging behavior. 4. Seek professional help. If the child's trauma is severe, seek the help of a mental health professional. They can provide therapy, counseling, and other resources to help the child overcome her or his trauma. Be consistent. Consistency is essential when working with children dealing with trauma. Create a consistent routine, provide consistent messages of support, and follow through with your commitments. 6. Practice self-care. Supporting a child who has experienced trauma can be emotionally draining. It is essential to practice self-care and seek support for yourself to prevent burnout. Remember, every child is unique and will respond differently to trauma. Be patient, kind, and supportive, and remember that healing takes time. 7. Educate yourself. Educate yourself on trauma and its effects on children. This will help you understand the child's behavior and respond appropriately. 8. Use age-appropriate language. When talking to children about trauma, use language that is appropriate for their age and level of understanding. Avoid using graphic or scary details. 9. Encourage healthy coping skills. Teach the child healthy coping skills such as deep breathing, journaling, or drawing. Encourage them to engage in activities that they enjoy and find relaxing. Foster a sense of control. Trauma can leave children feeling powerless and out of control. Foster a sense of control by giving them choices and allowing them to make decisions whenever possible. 11. Focus on strength. Children who have experienced trauma may have low self-esteem and a negative self-image. Focus on their strength and accomplishment and help them build a positive self-image. 12. Be aware of triggers. Trauma can be triggered by a certain situation or event. Be aware of what triggers the child's trauma and try to avoid those triggers whenever possible. 13. Involve parent and caregivers. Involve the child's parent and caregivers in the healing process. Provide them with resources and support to help them support the child. Remember that healing from trauma is a process and it takes time. Be patient, supportive, and understanding, and provide the child with a safe and nurturing environment. With time, the support the child can overcome their trauma and heal. Build trust. Children have experienced Children who have experienced trauma may have trust issues. Build trust by being reliable, honest, and consistent in your actions and words. Avoid making promises you cannot keep. Validate their feelings. Children who have experienced trauma may have strong and intense feelings. Validate their feeling and let them know that it's okay to feel what they're feeling. 16. Use play therapy. Play therapy can be an effective way to help children who have experienced trauma. It allows them to express themselves in a nonverbal way and helps them process their feelings. 17. Address behavior issues. Trauma can manifest in behavior issues. Address behavior issues promptly and consistently. Use positive reinforcement and avoid using punishment. 18. Build a support network. Building a support network can help for both the child and the caregiver. Seek out support groups, therapy, or counseling to help you and the child cope with trauma. 19. Practice trauma-informed care. Trauma-informed care is an approach that recognizes the impact of trauma and aims to create a safe and supportive environment for those who have experienced trauma. Practice trauma-informed care by being patient, understanding, and supportive. Number 20. Focus on the present. Help the child need and the future rather than the past. Encourage them to set goals and make plans for the future. Remember, every child experience of trauma is unique and they may require different forms of support. It's essential to be patient, empathetic, and understanding as you help the child heal and move forward. In the episode 1, we looked at some statistics, and I would want to add that statistics to this, and then we will end with it. According to the National Child Traumatic Stress Network, approximately 25% of American children experience at least one traumatic event before age of 16. Children who experience trauma are at an increased risk of developing mental health disorders such as depression, anxiety, and post-traumatic stress disorder, PTSD. 3. Studies have found that between 40% and 60% of children who have experienced trauma will develop PTSD. 4. Children who experience trauma are at an increased risk of engaging in risky behavior such as substance abuse, self-harm, and risky sexual behavior. 5. Children who experience trauma are more likely to experience academic difficulties, social difficulties, and physical health problems. 6. Children who experience trauma are at an increased risk of future victimization and re-victimization. 7. Children who experience trauma are more likely to have trouble with emotional regulation and exhibit challenging behavior. It's important to recognize that these statistics represent real children who are struggling with trauma. By providing them with support, resources, and, and a safe environment, we can help them overcome the effect of trauma and move towards a brighter future. According to the World Health Organization, an estimated 60% of children worldwide experience some form of violence, abuse, or neglect. Children who experience trauma are more likely to have a shorter lifespan, with studies showing that they may die up to 20 years earlier than their peers. Trauma disproportionately affects children from marginalized communities, including those who are low income, homeless, or living in foster care. Children who experience trauma are more likely to become involved in the criminal justice system, with studies showing that up to 80% of incarcerated youth have experienced some form of trauma. According to a report from the American Psychological Association, childhood trauma cost the United States $124 billion annually in healthcare, education, and criminal justice system expenses. Children who experience trauma are at a higher risk of experiencing chronic diseases such as heart diseases, diabetes, and asthma. A study published in the Journal of Traumatic Stress found that childhood trauma can have long-lasting effect on brain development, leading to a range of mental health and physical health problems later in life. Children who experience trauma are more likely to experience challenges in forming and maintaining healthy relationships. These statistics highlights the urgent need to address childhood trauma and provide children with the support and resources they need to heal and thrive. By investing in prevention and early intervention programs, we can help reduce the impact of trauma on children and create a brighter future for all. So we look at how long it takes for children to overcome trauma. The time it takes for children to overcome trauma can vary widely depending on a range of factors, including the type and severity of the trauma, the child, the child's age, and the support and resources available to them. For some children, the effect of trauma can be short-lived and may not require any specific intervention. For others, however, the effect of trauma can be long-lasting and require ongoing support and treatment. It is important to note that there is no set timeline for healing from trauma, and it's a process that can take months or even years. Recovery from trauma is not a linear process, and children may experience setbacks and challenges along the way. The most effective approach to helping children overcome trauma is to provide them with a comprehensive and individualized treatment plan that addresses their unique needs and challenges. This may involve a combination of therapies such as play therapy, cognitive behavioral therapy, and family therapy. It may also involve the use of medications to help manage symptoms of anxiety or depression. It's important to provide children with a safe and supportive environment to help them build resilience and coping skills, and to involve caregivers and other family members in the healing process. Overall, the process of healing from trauma is complex, and it's important to approach it with patience, empathy, and understanding. With the right support and resources, however, children can overcome the effect of trauma, and go on to lead happy, healthy lives. It's a very worrying details, and I would leave that discussion for another time. I encourage you to look out for children who are in one condition of trauma or the other. And we should also look out for children in a way that can make them safer, to prevent them getting trapped in any traumatic situation. Sometimes it's hard to describe how it feels to have traumatic experiences as a child. When you are an adult, you can only remember so much from your childhood memories. But that does not negate the fact that the effect of whatever happened in your childhood had registered certain nerves in you that causes the impact the trauma had on you to be triggered by certain situations. And if we would be able to help children, even adults, in a way that would prevent them getting into traumatic situations, and those that unfortunately have found themselves in situations that have made them traumatic, when you're dealing with them, be patient. When you are around them, be empathetic. When you have to do anything to support them, let it come from a genuine heart. Be kind. Be kind. And be kind. Life is really precious. Life is beautiful, but it can only be uncovered by kindness. The beauty of life are always shrouded in situations. If you're kind, if your thoughts are stemming out of love, if you're patient, you see that it's all in one. And it has all been one. If children are traumatized, family get very worried. Parents get very worried. Spouses get very worried. Even the children, their trouble cannot be understood. Yet, they are to endure it. If we have any opportunity to make life better for anybody, let's do it. I would always encourage you. Do anything you can do in your capacity to get someone to believe that there is a reason for them to live. There is a reason for them to hold on. There is a reason for them to hope again. These are very heavy for me. I hope we will be able to think through it and see what we can do to help anyone who comes around us and needs help. I want to thank you very much for staying, and going through with handling children with trauma with me. I thank you for your time. I expect your support, subscription, comment, questions, and likes, share, and we'll be happy we all put our strength together to get the conversation going. If you wish to get in touch with us, the number to text or call is 347-658-7385, 347-658-7385. The email address is quesivoom@gmail.com, KWESIVROOM@gmail.com. Thank you for tuning in. Goodbye.